Hi there, my name is Dr. Andrew Schmidt. I'm a director of Lifeguards Without Borders. In collaboration with the European Association of Surfing Doctors, I want to go ahead and make this quick video in response to some recent events in the surfing community this week. The information presented is primarily going to focus around the initial treatment of the drowning victim. As surfers, many of you may come across a patient who's in distress in the water and possibly unconscious in the water. I think if we all know the basics of exactly what's going on in drowning, exactly how to treat drowning, we can really improve someone's outcome. As many of you may have heard, it's been a pretty epic week in Europe. Some large swells coming through have resulted in what could possibly be the largest wave ever surfed. On October 28th, a Brazilian surfer, Maya Gabeira, was surfing a very large wave and unfortunately suffered an injury during her ride. This left her in the water, needing rescue from another surfer nearby. That surfer was Carlos Burrell. I apologize if I'm not pronouncing his name right. He was on a nearby jet ski. He made multiple attempts and finally had to enter the water himself to rescue Maya. There's been a lot of discussion on the techniques he used and what went wrong, what went right. I'm not here to discuss that today. I think he needs to be applauded in general for his heroic efforts, which did result in the saving of a life. Once they reached the beach, resuscitation was undertaken. There's not many details on exactly what went on the beach. This picture here does show some mouth-to-mouth ventilations being administered. But what I really want to talk about today is what was brought up in an interview with Carlos. Carlos was interviewed during the video segment online, kind of going through exactly what happened during the rescue. What I want to talk about, what concerns me, are some things that he said during the interview. Again, I want to really emphasize that Carlos did a great job in rescuing Maya, but I just want to make sure the right information is out there. First of all, he said, quote, "We did resuscitation. Thank God I did a course last year." He then went on to say that he learned that you don't use any more mouth-to-mouth breathing, likely referring to being taught compression-only CPR, which we'll go over in a second. And lastly, he talked about massaging the chest, referring to CPR, and how the patient continued to vomit. I think this interview brings up a couple of important points to discuss. Primarily, what exactly is drowning, what happens when someone drowns, and what's the best way to treat it? I think if we're all on the same page with this, we can make the best difference in the lives of those who have suffered a drowning injury. So hands down, the most important thing to understand is that drowning is a problem of oxygenation. The person has a lack of oxygen. This lack of oxygen leads to any injury down the road, primarily brain injury, and also any death down the road. So because of this, our primary goal of treatment is to provide oxygen. Now what Carlos alluded to in his interview, and what really has a lot of people confused, is this whole issue with compression-only CPR. Large-scale organizations like the American Heart Association and the European Resuscitation Council have called for compression-only CPR in the treatment of adults who have a heart attack. It's very important to understand that this is different from a drowning. In the case of an adult walking down the street who has a heart attack, this is a cardiac problem. It's an issue with the heart. Their blood has stopped pumping around the body. The blood still has a high level of oxygen. So what you do to treat it is you act as their heart. You give them compressions. The main issue with drowning is that it's a lack of oxygenation. These people have low oxygen levels. So we need to give them oxygen. If you come up to this person and just start doing chest compressions, what you're essentially doing is pumping blood with low oxygen around the body, and it's really not helping the problem. So for this reason, tucked way in the back of most of the international guidelines for American Heart Association and European Resuscitation Council, they do have statements stating that CPR for drowning patients should still include ventilations. This goes with the old CPR that most of us know, the ABC method following airway breathing circulation, where we still keep rescue breaths in the CPR algorithm. So what about the vomiting that Carlos talked about? That's actually pretty common. If you think about it, air plus water equals foam. So you can get some foam produced in the lungs and in the airways that'll come out the mouth. Also, with the CPR and the rescue breaths, you're going to cause some stomach distension, which will cause vomit to come up through the mouth as well. What I want to get through here is that this shouldn't delay ventilations. Yes, it's scary to come up on someone that looks like the lady in this picture here, but if you can find a way to give this person oxygen, you're going to do the greatest amount of good. Some agencies teach to suction the patient, roll them over, try to clear the airway of vomit and foam. But if you can get ventilations in this person, whether mouth to mouth or the use of a pocket mask or through bag valve mask ventilations, you're going to do the greatest amount of good. In addition, it's important to understand that any maneuver that's focused at ridding the lungs of water should not be used. This picture shows the Heimlich maneuver, which has been popularized in the past. The idea behind it is that people think the lungs are full of water and that you must rid the lungs of water before you can do any resuscitation. As I stated previously, yes, a small amount of water does enter the lungs, but it's actually a very small amount. The most important thing is getting these people oxygen. So if you spend 30 seconds to a minute giving this person the Heimlich maneuver, what you're not giving their brain is oxygen. So that about sums it up. This picture here was taken during the resuscitation of Maya, and it does show people giving rescue breaths, and I think that's great. Mainly, like I said, what I wanted to cover was the information that was given in the interview. I think if we all understand the basics of drowning and the basics of how to treat a drowning patient, and understand why we're treating them the way we are, we can really have a big impact. I want to thank you for listening to this talk, and I want to encourage you to contact one of our organizations if you have any questions. We as surfers are often the first line of defense when it comes to the rescue and the treatment of those in distress in the water. Stay educated and save a life.